Let's talk about X-ray challenges for technologists and imaging specialists. Medical imaging and radiologic technology is a science and an art. The medical imaging specialist must not only qualify in knowledge, but demonstrate the ability to apply that knowledge, including upgrading their skill and knowledge levels as technologies advance and evolve. In the United States of America, there is no national licensure for operating medical equipment and especially equipment using ionizing radiation. The minimum standards are set by each state for operators of equipment using ionizing radiation. For this presentation, we will assume that all operators of imaging modalities have the minimum state licensure and certifications for the modality they operate. What is the difference between a license and a certification? A license is issued by a state or government entity and is a legal document. A certification is not a legal document. It is merely a recognition of your qualification. Licensure for using X-ray in medical imaging varies state by state, and some states may not have or require a license. For medical imaging, the ARRT, or American Registry of Radiologic Technology Certification, is one of the largest certifying entities in the United States for medical imaging and has a number of disciplines that they certify, from X-ray tech to MRI to ultrasound. There are a number of challenges for medical imaging technologists and radiographers or X-ray technologists. Some of the biggest challenges include dealing with patients in pain or discomfort daily, which can be stressful. Additionally, X-ray technicians or technologists must constantly learn new material and keep up with new technology, which can be challenging for some. Another challenge for medical imaging specialists is that their work is not appreciated and often goes unnoticed by referring physicians and patients. When there's an accident or medical error, rarely is the modality held directly responsible. It is the operator. Integrating computers and automation into medical imaging combined with AI or artificial intelligence often causes the operator to become over-reliant on the automated or technical aspects of imaging that are controlled by the modality. It is when the operator trusts and relies upon the automation to the point that their basic skills and medical imaging understanding are allowed to degrade. Remember, if you don't use it, you lose it, and this is especially true about knowledge and skill. So let's take a little closer look at automation and medical imaging. Is automation of medical imaging causing missed pathology? That's the question that keeps on giving, but what's the answer? As with everything else, there are plenty of opinions. The first opinion is typically held by the older, more experienced radiologic technologist type, and is the belief that today's medical imaging utilization of automation is an accident waiting to happen. Too much reliance on automation, they say. Younger people in the field hold a different view. Automation is what makes medical imaging diagnostics essential and safe, and to some extent, they are both right. However, it's the next group of people and their opinion that has caused the problems. The third opinion group feels that technologists should be viewed as a backup to automation. To them, automation is a digital messiah and can do no wrong. There's just one problem with that view. Humans, us imperfect humans, envisioned, engineered, and built the automation on which these people are willing to place their total faith. Furthermore, once designed and made part of medical imaging technology, the same imperfect humans write the software and programs the computers use. Those points nullify the human-hating notions of this group and beg the question, Is automation killing people? One thing is certain, in one way or another, automation and the attendant erosion of patient skills and radiologic technology skills plays a major role in missed pathology and reduced patient safety. There are numerous causes of medical imaging examination errors. They can be the wrong patient, the wrong procedure, the wrong side, or the wrong site. Some of the other factors include similarity of site, procedure, and patient names, breakdowns in communications and teamwork, patient and procedure factors, and failed safety check exams. In fact, if you take a look at this comparison of radiology events or errors that occurs, you can see the differences between the year 2009 and 2017. Taking a look at the right-hand side, or the year 2017, you'll notice there's a marked increase in the number of events or errors. To eliminate errors, the medical imaging professionals should verify patient and procedure details at every point along the medical imaging care continuum. Medical imaging specialists should verify patient and procedure details at every point along the medical imaging care continuum. If the team identifies conflicts or cannot verify information, you need to stop and clarify and make sure that you're doing the examination correctly in acquisition and interpretation. As we've seen so far, medical imaging is complex and has many aspects to it that the general public and many of the physicians that are requesting exams do not understand. The one question that needs to be answered is the training in medical imaging keeping pace with technical and healthcare environmental changes? Because individual training is so chaotic and different types of training exist, such as OJT, applications training, didactic or school training, we really can't answer that question. But we can say that a good technologist or medical imaging specialist tries to keep current with education and skill practice. There is no lack of continuing education programs available in medical imaging, and there are a wide range of types of programs available, ranging from didactic lectures to virtual imaging training, online training, and more. Another method of keeping your skills applicable are being mentored by an advanced or more senior person using the modality. The ARRT certification requirements for continuing education, these are called CQR. The ARRT has continuing qualification requirements for all imaging modalities and specialties. They require that the certified person meets requirements at least every 10 years. The ARRT program, CQR, assesses the knowledge and skills of people certified for medical imaging by the ARRT. There are 6 major eligibility pathway requirements. Today, more than ever, patients demand high-quality care and accountability from their health care providers. Another type of training is applications training, and this is usually provided by the manufacturer when installing new equipment at your facility. The application specialist provides hands-on training on the equipment. Unfortunately, one of the problems with applications training is the training is only as good as the trainer, and most times many people are called away from the training to actually go and perform exams. On-the-job training is a practical approach to acquiring new competencies and skills needed for a job in real or close to real working environment. A mentor is assigned to the person learning the skills. The mentoring is only as good as those individuals who provide the information and training. Do you recognize the comedian Rodney Dangerfield, whose line was, "I don't get no respect"? Technologists working in medical imaging often find that there is a lack of professional recognition from the public and other healthcare professionals. It has long been a question whether medical imaging is a profession or a trade. Many wonder if medical imaging is a trade or a profession. Well, a trade is a line of labor that typically involves manual or artisan procedures but does not call for a formal education. A profession is a line of practice involving specific academic education. The level of education needed for each is what distinguishes a trade from a profession. Unfortunately, this question will linger on because of the non-standardization of requirements to be a medical imaging professional. And it does require both education and mechanical skills. This quandary of trade or profession is reflected in the above hierarchy of management for a hospital system, which includes radiology or medical imaging. In medical imaging, the radiologist is a professional based upon their medical education, and they must apply to become certified or board certified in radiology. This process can take up to 14 years. As we discussed earlier, for an imaging professional, there may not be any requirement for licensure or certification by the state and the hospital that employs them. Let's look at another challenge for medical imaging specialists: stress. Stress is a very common problem. There has been considerable research on stress in certain healthcare professions. However, there is very little known about the importance of occupational stress on radiographers and medical imaging specialists. Stresses for medical imaging professionals include heavier workloads, inadequate training, and improper procedures. Medical imaging management must recognize these stresses and produce realistic solutions to the problem. Well, this is Mark Struthers, and that's a quick look at some of the questions, problems, worries, doubts, and solutions in medical imaging.